So let's discuss about question number 151. Massive bleeding per rectum in a 70 years old patient is most commonly due to. So answer is A, that is diverticulosis. Diverticulosis. So my dear friends, although the anorectal disease causes bleeding per rectum is the most common cause of bleeding per rectum in elderly patients, these lesions usually cause small amount of bright red blood on the surface of stool and or you can say toilet tissues. These diverticulosis may give rise to massive clonic bleed the usual presentation of diverticular hemorrhage is that of brisk, painless passage of maroon color stool and it is the most common cause of bleeding. It is the most common cause of massive bleeding per rectum above 55 year of age. So question number 152. Which of the following statement is incorrect regarding Dubin-Johnson syndrome? So the answer will be over here D. Answer is D, that it results in unconjugated hyperbilirubinemia. Unconjugated results in unconjugated hyperbilirubinemia. Now what is Dubin-Johnson syndrome? Let's discuss about Dubin-Johnson syndrome. Important points to know: it's an autosomal recessive disease. It's an autosomal recessive It is an autosomal recessive disorder. It is an autosomal recessive disorder resulting in hyperbilirubinemia, it is due to the defect of in the canicular multispecific organic anion transporter, we call it as C, and it's a protein. This causes defective hepatic bilirubin excretion. Question number 153. Pontic fever is caused by B. Legionella. It is caused by Pontic, or we can say it is Pontiac fever, other name is Legionnaires disease. Now, Legionnaires disease is basically a formation or of pneumonia caused by Legionella. Question number 154. It is a pictorial diagram and it states that HIV patient presents with lesion shown in the figure most like caused by which of the following. So it looks like the patient is having fungal disease. So the answer will be B, fungus. So here we can think that the patient is having secondary oral pseudomembranous candidiasis, secondary oral pseudomembranous candidiasis infection. Candidiasis infection. Question number 155. It is again a pictorial diagram and it says the following varium swallow shows the presence of. So my dear friends, the answer over here will be esophageal varices. The answer will be esophageal varices. The image shows worm-eaten appearance of esophageal varices. So it shows that worm-eaten appearance of esophageal varices here we can see description of this esophageal varices is it is serpiginous, thickening of folds, which appear round, oval filling defect, it resembles beads of rosary, Point differentiating is from malignancy is malignancy of esophagus is uniformity of the lesion. Question number 156. Which are true of hepatitis E virus? Answer is A. It is a 34 nanometer single stranded RNA virus. Single stranded RNA Now this hepatitis E is basically the most common cause of epidemic hepatitis in India. Epidemic is India, but the most common cause of epidemic hepatitis in children is hepatitis A. So there are two questions which you can get confused. Epidemic hepatitis overall they are asking, then it is hepatitis E. If they are asking epidemic hepatitis in children, then it is hepatitis A. Please do remember this. Then is question number 157. Which is the most common site of malt? So question number 157. Answer is A. Stomach. Answer is A. Stomach.